topographical view of this. And there's a lot of different things that we can identify on this. However, for the midterm exam, I just want you to know a few things. All right, and then for the final, we'll get into a little bit more detail, but it's really not too bad. So this right over here is the uncinate process. This is the superior articulating facet. This right over here is the lamina, and this is the bifid spinous process. And so now, if you go to the posterior border of the vertebral body, there's this structure right over here. That's the PLL, posterior longitudinal ligament. And then we're going to have the meninges, which are 3 membranes that are going to enclose the spinal cord. But we're not going to worry about those meninges right now. So here's the spinal cord. And then if you look over here, just deep to the lamina, that is the ligamentum flava. So 2 ligaments here, PLL and ligamentum flava is what you need to know. These other things that you might see are meninges. We'll wait for the next exam for those. So now let's take a look at this spinal cord cross section and note that this is anterior and this is posterior. So off of the spinal cord on the anterior portion is the ventral root. And then off the posterior portion is the dorsal root. You'll recall from Dr. Reefs, the ventral root is motor, efferent, outgoing. The dorsal root is afferent, sensory, incoming. And so as these 2 roots kind of come together, they meet pretty close to the intervertebral foramen. And just before they come together, the dorsal root has a group of cell bodies called the DRG, dorsal root ganglia. And after the dorsal root and ventral root come together, it's referred to as a common spinal nerve. Common spinal nerve. And then the common spinal nerve is going to divide up into a dorsal ramus and a ventral ramus. And the way things are set up for this course is that your ventral rami are supplying all of these superficial back muscles, with the one exception of the cranial nerve 11, which comes directly off the brain. And then, after we have our midterm, we're done with the ventral rami and the superficial back muscles, and then we go to the deep back muscles. And then, they're supplied by the dorsal rami. Okay? So, first half of the course, superficial back muscles, ventral rami. Second half of the course, deep back muscles, true back muscles, dorsal rami. So for the practical, I want you to be able to say PLL, ligamentum flava, ventral root, dorsal root ganglion, dorsal ramus, ventral ramus, common spinal nerve, vertebral artery, and sympathetic ganglion or sympathetic chain. Either one would be okay. That's it. Let's get to work.